Hey guys, Jim Hoffman here from EMSSEO.com. And I'm always looking at various EMS websites. And of course, one of the most popular is EMS One, right? And my friend Greg Fries from there, he's the editorial director there. He posted a sort of 8 tips to help you with patient assessment. And I was reading the article, and there were 3 that really stood out to me that I thought I would share with you. I'm also going to put a link to the complete article in the notes below. But one thing that he pointed out was about when you're talking to your patient and how important it is that when you get more than one EMS provider or somebody else on scene asking patients all these questions, right, about their pain, about their medical history, what ends up happening, the patient can get confused or even miss questions or the important information that you're looking to gather from them. So instead of everybody firing questions to the patient, let one person ask the question, and that same person can also do the assessment. They can explain what's going on, and that could be the one that's actually verbally building that rapport with the patient, right? Now, on a side note, one thing that I would do, because I hated when my partner would jump in, or I would jump in with my partner when we were doing patient assessments, is if your partner is done, or I'm done, or whatever the case may be, a lot of times I'll say to my partner, "Are you done?" And they would say yes, and then I might ask a question that I felt was vital or important that my partner might have missed, right? You don't want to miss things during your assessment, but you don't want to confuse the patient either. So keep that in mind when you are engaging with your patients and you're building that rapport and you're trying to find out what's going on with them. The second thing I want to mention, this is something you might not feel is that big of a deal, but is to reduce distractions on the scene. We go to people's houses all the time, right? It's their kitchen, their living room, the bedroom. It could be outside someplace. There's all kinds of distraction. Or water could be running. There could be a TV on. There could be the radio on. It could be a dog barking. It could even be family members or bystanders sort of getting in the way and kind of confusing things. So as a provider, as a professional on scene, there's not a problem if you go ahead and ask somebody politely to turn off a radio, turn down a television, stop a dog from barking, right? Even ask bystanders to step back if you need more space in order to be able to go ahead and treat the patient, okay? The one thing Greg mentions in the article, which I thought was a good idea too, that if you've got a lot of people on scene, a lot of providers, everyone wants something to do, right? No one wants to just be standing around doing nothing. So if you have enough people, assign somebody to go ahead and manage the bystanders, to communicate with them or what's happening and what's going on, especially if there's family member, to go ahead and let them know what's happening to the patient and helping gather even more information to help you with your assessment. This helps you, by the way, too, stay focused on the patient and the task at hand. Now, one more I'm going to mention today, and like I said, Greg has 8. I'm only covering 3 real quick. I think it's a great idea to go and check them out. Get the other 5, which I think is key. He talks about using aids, about getting back to basics, giving specific instructions, all great tips that Greg puts down. But the third one I want to talk about today is documenting as you go. Now, a lot of times you might be on the scene, you might have seen other providers ask a patient or a family numerous times certain questions, right? What kind of medications they're on, what allergies they have, when the complaint might have first started, all of that. That lends to be confusing for the patient and other providers. It also kind of makes you look not that professional. That makes you kind of look confused as the professional provider on scene, that you're not paying attention to them, right? So document what you find out about the patient's history, what's going on, what's happening as you go. I keep a nice small little notebook in my pocket. I take it out and I'll jot down the key elements of the assessment, including vital signs if I have to, as I'm going, okay? I have my own sort of shorthand. I know how to write down certain medications, so when I go back and look at it, I know that metoprolol is one thing, but I might just write down meta on my pad, right? So things like that can help you, so that when you go back and you open up that little notebook or scrap paper or whatever it is, you can go ahead and transfer them into more coherent notes in your tablet or on a call report or whatever the case may be. Okay, guys, again, just 3 quick tips I wanted to give. I thought when Greg put this article out the other day, I thought it was really valuable. I wanted to pass that along to you in case you're missing out on some good content that they have at EMS One. A lot of people don't like them. They feel they're too advertising and stuff like that. And I can agree with that to a point, but I think that the website itself has a lot of amazing information that you can go ahead and take advantage of. So go check that out. Again, I put the link to that article below, and I hope this helps you do better patient assessment. And I'm going to go take care of my dog in the background that keeps barking. All right, guys, that's it for me. As always, Jim Hoffman from EMSSEO.com. Stay safe.